Hi, everyone. We'll go ahead and get started. Welcome, everyone, to the Truework webinar about returning to work and how to keep employees safe. Today on our panel, we are fortunate to have a great set of experts ranging from health to policy, compliance, to those on the ground actually working in HR and getting employees to work every day today. We have Becky Smith, Dr. Becky Smith from Duke University. Becky leads infectious disease and control at Duke and is going to walk us through some of the big unknowns that still exist today and how we can best take safe approaches to bring our employees back to work. We also have Kimball Parker from 650, a division of Wilson Sonsini. And Kimball's going to talk about policy and compliance that needs to be considered when bringing employees back to work. And finally, we have Ryan Higginson-Scott, Senior Director of People Operations at Fuse, and he's going to walk through a case study about how Fuse is bringing employees back to work, both safely and progressively. I am Ryan Sandler, CEO of Truework, and I will walk through our new employee management tool to help bring employees back to work. So if we go to the next slide, to start at a high level, we know states across the country have already started, reopening or on the path to reopening. We have this up-to-date map here from yesterday of you can see most states are already opening and others have a pathway. And so employers across the country, both from small businesses to some of the biggest brands, are spending a lot of time right now figuring out how they can bring employees back, what policies they need to put in place. Do they need to do testing? What type of PPE do they need to have for every employee? And there's a lot of open questions. We have guidance from the CDC and from other government bodies on some best practices, but we're here today to talk about how can we go far in protecting employees' health while not breaking any other regulations like discrimination or anything else that can make employees feel uncomfortable. And so it's a very moderated approach that we all are taking here and we all need to take. And there oftentimes is no right answer. There's oftentimes options of ways that the approach can take. And when coming up with an approach, there's a lot of things that need to be considered, both from the legal side, but also from employee experience. Are employees comfortable coming back to work? What are the policies that are going to make employees comfortable? And a lot of HR teams, workplace safety team, are really optimizing for that employee experience in the day, as well as the legal and safety risks. But in terms of policy, you need to provide sick leave for employees. You provide support if they do contract COVID. And you need to have a phased return that allows you to separate employees by cohorts, allows you to send employees back if they're within a cohort that gets sick. And within this phased return, there's a number of legal risks, and the employee policy might be changing a lot as guidance change. And how do you keep that policy up to date? And finally, when you do go back to work, how do you maintain the best communication that resonates with your company culture, is not too intrusive with employees, but allows you to maintain safety throughout the reopening process? Kimball, we'll turn over to you, and how about you walk us through some of the policy and compliance considerations when opening up?
Yeah, thank you. So this COVID-19 situation really has put employers in a very, very difficult situation. And the reason for that is that the law requires employers to provide a safe working environment for their employees. And that's on the federal level and the state level and the local level, which I'll get into. But how can an employer do that? How can an employer create a safe working environment while COVID-19 is spreading? And we heard from Dr. Smith kind of run through some of those things that can help. And from a legal point of view, basically employers need to take reasonable measures to protect their employees. And so what I'm going to do, I'm going to kind of run through the legal landscape pretty generally on those three different levels: federal, state, and local. Then I'm going to talk about kind of some of the legal compliance documentation you need to show as an employer that you're checking all the boxes in case something happens. And then kind of some of the dynamics that are unique to this situation, which make getting those materials and keeping them up to date very difficult. So I'm going to start with the legal landscape. So there are really three layers of laws here. There are laws on the federal level from the EEOC, the Equal Employment Opportunity Commission, from OSHA. OSHA makes sure that there are safe working environments. From the FMLA, and on kind of a general level, the EEOC and OSHA really require employers to provide a safe working environment for their employees. It requires employers to protect their employees from known hazards, and COVID-19 under the law has been designated as a known hazard. So this means that under federal law, employers really need to take reasonable measures to protect their employees from that hazard. And so again, a lot of those reasonable measures are just one slide back, and covered by Dr. Smith. But that's mandated by law, and the standard really kind of for employers to peg their actions to are reasonable measures. Like, you don't need to test every single person every hour of all of your employees every hour. That's unreasonable. But like Dr. Smith said, if somebody has symptoms and you do a daily screening, they have symptoms, it's reasonable to require them to take a test and to find out. So that's the federal level. There's kind of a federal band of law. Under that are state laws, okay? And so states have their own laws. Some are more strict than others, depending on where you are. You can guess which ones are kind of the most strict there: California, New York. And those laws have those state laws have several different aspects to them. The first I want to talk about is negligence. Okay, now there are employees can sue their employers if their employers don't take reasonable steps to protect them under negligence law. Negligence basically means that somebody who owed you a duty didn't do what they needed to do to protect you. And so those negligence laws are in every state in the nation, okay? And so employers can be liable. They can have to pay for employee damages if they don't protect them. So that's under state law. Second, some states have come out with some presumptions. So for example, the governor of California announced that anybody who goes back to work, if they become sick within 14 days, it's presumed that they got that illness from work, okay? And that presumption is used for workers' compensation purposes, but it's pretty dangerous in that it could possibly be transferred over into a case, into a lawsuit from an employee to an employer who got sick. So there's a presumption in some states that if employees get sick, that they got it from work. And then there are kind of regulations that govern employee safety, and a lot of those mirror federal law. Below that, on the state level, are local laws. So different counties have laws, different cities have laws. If you're, depending on what county and city you're in the Bay Area, you may need to post certain signage up, but other counties you may not. And so these layers of laws make this very complicated, and they change on almost a daily basis. So Dr. Smith even talked about that with the CDC, so all of those CDC standards are really baked into these different standards about creating a safe working environment, and these change all the time, okay? So this creates a very, very difficult legal situation for employers. And there are two reasons for that. The first reason is that usually if you went to a law firm, let's say, and said, hey, I need a policy about X, let's say about sexual harassment. The law firm is really working off a template. The law firm has had a sexual harassment template for probably 50 years. It's been iterated and adjusted based on kind of changes in the law. And what a lawyer really does is take that template and adjust it to your specific circumstances. And really the existence of that template lowers the cost for them to provide it to you. So here with COVID-19 and returning to work, there is no template. Okay, there's been no situation like this in the history of employment law. And so going to a law firm, you have to pay for them to create that template. It's probably going to be the most expensive policy you ever create because of that. They're not working on any kind of base. So that's number one. Number two, the reason why this almost makes kind of receiving this kind of work traditionally from a law firm impractical are these changes that we've talked about. You could spend tens of thousands of dollars having a law firm draft a policy for you or perform an assessment, a gap assessment of kind of how you're doing. And that assessment could be outdated in a week and the policy could be moot, depending on changes to the CDC and your state authorities and your local authorities. And so this creates a very difficult situation. And so what companies really need here, they need assessments and they need to document it. So they need to document the steps that they considered and the steps that they've taken. And again, that's in case anything, heaven forbid, something bad happens, that they can say, look, we considered all these steps, we took these measures, and so it's very unlikely that X person got sick here. Number two, they need policies. So the assessment is for their, for leadership purposes. The policy is to communicate the plan out to employers. And that needs to be documented and it needs to be high quality. Okay. And so assessment policies, and then you need a plan to put those policies into place. You need to collect consent from employees. You need to collect employee information. And Truework is going to help with some of that. And so, but those policies and those assessments are vital during this time. If you don't have them, you open yourself up to some significant legal risk. So let me tell you kind of what we've done with what we've done with Wilson Sonsini, and now we're kind of partnering with Truework. Wilson Sonsini is the most important technology law firm in the world. Okay, so they helped found Apple and brought them public, and same with Google and Tesla and Lyft and Twitter, and so they really represent some of the biggest, most important technology companies in the world. They have one of the best employment practices in the nation. And so what we did is we worked with the employment group there and with some medical professionals to think through, like, okay, what are all the things that a company needs to consider? All the way from, like, are you going to have everybody arrive at the same time? When you come back to work, do you need to stagger it? You don't want everybody riding up on the elevator all together, to, are you going to stagger the days? Or, maybe you need to look at your ventilation system. Are you going to move your office space? A lot of the things that Dr. Smith just said. And then we had the firm also develop some policies, and then we automated it on our automation system. And so the benefit of this is that instead of paying a lawyer to come up with a policy and an assessment for you from scratch, we can deploy that with Truework in under 20 minutes and get you an assessment and a policy ready. The other benefit is, as the law changes, we update your policies and we can deploy that in real time. Okay, so you don't have to hire an attorney to sit and look at the CDC every day and to look at your state regulations every day. We have people doing that in the background, and we can deploy it to everybody in real time so that their policies are clean and up to date with the latest guidance from all the relevant authorities. And then Truework, and with our help with the policies, can put those practices into place, so that you kind of have a full circle. You have kind of your legal basis covered with the documentation you need in case something goes wrong, and the policies in place so that things don't go wrong. and to really prove that you're taking this seriously and taking reasonable steps there. So we're very excited to work with Truework on this on this important effort to help people come back to work here.
Great. Thanks so much, Kimball. Really, really helpful for, I think all the companies and HR folks on here who are thinking a lot about policies today. And as Kimball mentioned, we're really excited to partner together with 650, partner together with the folks at Duke and Pandemic Response Network to provide a holistic solution to businesses of all sizes on helping them return to work. And so, Truework at a high level, folks, don't know who we are. We help employers handle sensitive employee information, like income, like other employment-related information, and protect it behind their consent when they're sharing that data with banks and other third parties. And we decided to extend that platform to help employers capture COVID-19 related information from employees in a consent-based and a secure way. And so at its core, our COVID-19 management tool has a mirror of your active employees from your HR system. Truework plugs into over 20 HR and payroll systems. And when you connect, you see a list of your employees, and you're able to actually go in, add or edit information related to their health and related to their COVID status. You can also, if we go to the next slide, with Truework, you can send emails, questionnaires to employees on a weekly, on a monthly, whatever frequency your policy requires. As Kimball mentioned, you set that policy. Now you actually want to instrument it. Employees are going to receive an email every frequency with a list of questions that you customize. We have our standard list of questions based on the CDC and EEOC guidelines, but a larger employer might want to customize those questions based on their region or their state if things change. They might want to go and get more granular information. Might want to ask, are there any at-risk people living with you at home? Not only are you at risk. And so we're giving employers as much flexibility here as possible to ask the set of questions needed to get their employees back to work safely and have them, not affect the safety of their other coworkers. And at the end of the day, what's most important here is privacy and security. This is some of the most sensitive information about an employee. Both the demographic data, like age, and also their test information, their symptoms, their thermometer reading. And the most important thing is to protect that data behind consent. And so this whole platform, the employee has to give explicit consent every single time. It's shared back with the employer. If they don't want to, they don't have to. Your policy might be that you can't go back to work unless you share this information. But until you share this information, you can't go back to work. But that privacy and security, is the most important part of the platform and why we decided to build this. And the flexibility is the other important part here. We know, as Becky and as Kimball explained, these things are changing all the time. What is needed to come back to work today might be very different in a few weeks or a few months. If there's a vaccination that comes up, that's discovered, please to God, employers are going to want every employee to get that vaccination and prove they got that vaccination before coming back to work. So we built the system in a really flexible way that this survey is user inputted today to start, but we're integrating with many partners to bring in other inputs into the survey, whether that's a source of truth test information from the lab testing companies, a thermometer reading from a smart thermometer company, or any other inputs that come along the way. We're building in a very flexible way to make sure that employers are always able to meet these up-to-date guidelines. And so something that I think people touched on that we're really excited about is the integration of our software with 650 as well as with Duke. That you can imagine, you can set your policy in 650, have that logic flow into Truework in terms of the questions you're asking, in terms of the frequency, and then provide hotline and support from Duke's Pandemic Response Network for any employees that do say they have symptoms or have questions about, do I need a test? Can I go back to work? Should I go back to work? We want a human medical support on the other end of the line for employees and HR admins during those times. So really excited to provide our customers and new customers with a holistic solution to help employees get back to work safely. And with that, we're going to sit down with Ryan Higgs and Scott from Fuse. And to start, I'd love to ask Ryan, what is Fuse, and can you give a little background about yourself as well?
Yeah, absolutely. So I am the senior director of the global people operations team at Fuse. So we're a unified communications as a service platform designed to bring together and streamline enterprise communications. So voice, video calls, conferencing, integrated one-on-one and group chatting, content sharing, and contact center. So a lot of different tools, bring them all together into one platform. Um, and we're just under 600 employees globally. About 400 of those are in the US and Canada. So they're supported by Truework for initially our verification of employment. But the rest are spread across Europe and Australia. So as you can imagine, given Kimball's review of the legal within US, the scope of our population, our response to COVID has been a bit of a balancing act to maintain consistency and compliance across all of the populations, not only in the US, but in every country where there tend to be very different perspectives and what's allowed or disallowed. So it's been an interesting balancing act, certainly. But we have a technology that makes it possible to very easily work from anywhere, which is also a big part of our culture. So the technology makes it possible, but our culture makes it a reality. So we can work from anywhere. It's actually part of what we call a flex program, which includes all of our time off, leave of absence, et cetera. It's really designed to give employees kind of the maximum flexibility globally. But work from anywhere means just what it says. We allow our employees to decide what works best for them, as long as it's not to the detriment of the organization. As long as they're clear about their expectations. And we have about 15% of our employees who are fully remote. They're on full-time remote-based work arrangements at any time. So pretty high percentage of the population. And on top of that, most others are working from home regularly, at least once or twice a week. So, something that wasn't the idea of moving to a fully remote, environment or practice wasn't too foreign to us. But we did also have to be really conscious of, even if this is part of our core culture, we need to adapt to the cultural norms in each location too. So we have offices in Portugal and France and Canada, where most people are in the office most days, if not all days. So being really thoughtful about how we're respecting and supporting their needs as well has really been important. And we anticipate those employees will need to or want to return to the office sooner than most. Local regulations are also not equal. So some countries say they can't go back. Some countries say we can't tell them they're not able to go back. Right? We have to let them into the office if they want to go back. So it's been a challenge, and we're really focused on trying to find policies that can be policies and practices that can be global and provide the least resistance or friction to our employee experience, right? Make sure we're providing the highest level of support, but also giving employees confidence that, to the extent we can, we know what we're doing most steps of the way, and that we're really on top of things with keeping their their safety and security, but also their privacy top of mind. So our approach, as I mentioned, we had to really think about our philosophy around each of these transitions. So toward the beginning of the threat, when it was sort of just starting to spread, we looked at our philosophy and our values, and we thought, well, if we can't make this happen, how can we tell our clients they can do it with Fuse? So we were able to really quickly pivot. In the course of a day, we sat down, we convened a committee around our business response and preparedness. And we sat down with the CEO and said, look, this is what we're seeing. This is what we have to do. And he said, well, yeah, let's just do it. Let's tell everybody today, work from home until we tell you to come back. So we had to pull that back a little bit and set some expectations in terms of timeline and, make sure we were, really clearly communicating to employees. But now, as countries are opening back up, states, locations are opening back up, it's important to think about leading and when to follow, right? So we've kind of adopted this mantle of being an intentional laggard on returning to the office. We don't have to return to the office, and we're very conscious about saying, especially in most of our internal communications, returning to the office and not returning to work, because at this point in time especially, so many of our employees who are customer facing or an engineering team are working at more than 1x their standard productivity, right? So they're working extra hours because it's easy to, there's no commute. So returning to the office, we don't have to do that right now. So there's no reason to put our community, our internal community or our external community, at risk by rushing back. So we've really been focused on ways to enable that, to ensure, but also again ensure that flexibility around employee needs. So now that we're kind of opening back up, or as the world is opening back up a bit, we've moved this task force to really focus more on the future of Fuse at Work and what our phases of return look like, and whether or not the final phase is actually everybody comes back into the office, or whether we pivot to more of a remote first approach. We're looking at office layouts, locations, et cetera, and designing our community around sort of this remote by default ethos. So a big part of that has been increasing communications, activities, culture building, et cetera, but keeping in mind at all times that it doesn't fit everyone. So as we have responded to the threat and to our employees' needs, we had initially sort of hacked our employee case management tool to give employees a place to self-report when there were symptoms, or if they had been exposed or tested, et cetera. And it wasn't always necessarily sending an email to our generic HR inbox or submitting a case and not really knowing where that's going. Sometimes that feels uncomfortable, especially if you're talking about health or risk. So we recognized that wasn't really a great fit. So implementation of Truework's COVID-19 employee management tool has been really helpful, because it's given us a clear place to track those employees who are cleared to work in a secure place, a place that our employees are familiar with, right? They know that we use Truework for our verification of employment. They trust us to work with mortgage lenders and anybody who's looking for that kind of private data already. So kind of expanding the horizons there, which gives us a chance to really maintain that security and safety and privacy for employees, while still giving them the opportunity for that flexibility. So we're on the path to some sort of new normal, but it's great to work with partners like Truework, who help us to keep our employees first and stay compliant, but also true to our company values and really enable that flexibility.
Thanks, Ryan. Really appreciate you walking through that. And so with the last few minutes we have here, we're going to open up to some questions from the audience. And so the first one seen here is a question for Kimball of what type of information can employers collect legally from employees?
Yeah, so during normal times, it's not recommended and is often not allowed to collect health information from your employees, because it's irrelevant to their job. It doesn't help you with them. But during COVID-19, some of those rules are flipped. And so again, the EEOC has and the different federal agencies have labeled this a direct threat to employees, which then allows companies to basically collect any information that's relevant and helpful in preventing that threat from spreading in the office. And so for this circumstance, the law allows you to collect, let's say, symptom data related to COVID-19. Now you can't ask about injuries to their ankle or anything that has nothing to do with this disease, certainly, but anything related to this disease that would be relevant and helpful for you to prevent it from spreading in the office, you can collect. Now you have to store that data in careful ways, which Ryan, you kind of touched on, and it needs to be stored securely and safely. But as far as collecting it, absolutely, you can collect information about COVID-19 from your employees.
Super helpful. Definitely different times we're living in that allow more flexibility there. And then the next question for Becky, this might be the last one, is if the group of employees are inside and they're keeping social distance, do they really need to still wear a mask indoors? Say it's a large office and there's only a few people and there's social distance, do they still need to wear a mask?
So I recommend wearing masks as much as possible, indoors and outdoors. I think humans are social creatures, and unless you're going to have your floor like taped out so that everybody knows that exact space, everything, we draw these artificial lines at 6 feet because that's sort of the distance at which like aerosol droplets fall to the ground if someone cleared their throat or did, what if you have a loud talker? Many people may have seen that paper that came out about the choir practice. And so I'm not sure that everyone's singing at work. Maybe people have a lot of fun while they work together, but I think it's just indoors, especially to the extent you can be masked, the safer you're going to be, because you're going to have indiscretion. You're going to think, okay, I'm just going to pop in this person's office, and you get to talking and you may lose track of time. And so while if you look at the CDC guidance, it says 15 minutes of time unmasked becomes sort of like risk of exposure. What if you had, for some reason, someone who was shedding more virus, or, why put yourself in that risk? And I really think you want to encourage your employees to mask in the community and at home, and to avoid family gatherings where there may be no masks. And one idea that's kind of a fun one is even having employer logo masks that you give out to make it easier for them or for their families. I think we just need to make it easy for people to do the right thing.
Absolutely, that's really helpful. So with that, I know there's a bunch of other questions on the feed, but feel free to follow up with our team, and we would love to answer any questions afterwards. But with that, we're gonna have to end because we're at time. Thank you so much for all those who joined today, and thank you so much to our panelists.